Hello everyone. In this video, I'll talk about one of the components of the personal protective equipment, that is PPE. As you all know that PPE, that is personal protective equipment, it refers to the physical barrier which is used alone or in combinations to protect from mucous membrane, airway, skin, clothing from the contact with this infectious agents when you are providing care to the patient, whether it is a directly exposure or indirectly exposures. So PPE, it includes gloves, apron, gowns, facial protection, footwear and hair cover. So these are the various components which includes as a standard precautions under the personal protective equipments which usually the healthcare professionals wears to protect against from the infectious agents. So among all these personal protective equipments, I'll talk about today only about the gloves. So the outline of my presentation is what is gloves, types of gloves, understanding gloves pyramid. So gloves, which is used as a safety precaution, and it is, as I told, it is one of the personal protective equipments. It is as used as a physical barriers to keep away from the infectious agents. So it should never be worn as a addition as a substitute of hand washing. It is always considered as an additional measures, and it should not consider as a substitute of hand washings. And change gloves between the task and procedure whenever you're providing care to the patients. So suppose if you're providing or if you're doing a procedures in one patient or two procedures you're doing in one patient, so in that also when you're performing two procedure in the same patients, you need to change the gloves. And when you are changing the patient or you're shifting the patient for some examination or doing some another procedures to another patient, so in that case also you need to change the gloves between the tasks. And if the gloves have been torn or heavily soiled with body fluid, secretion, excretion, mucous membrane or non-intact skin, so in that time also you need to change the gloves, or if it is toned also. And remove the gloves immediately once you have completed the task, and after that you need to do the hand washing also. So perform washing immediately after the removing the gloves. It should not be practiced like that you have worn the gloves, so after removing that your hands are clean, so no need to do the hand washing. So after removing, it is mandatory and it is very preventive measures that you need to follow the steps of hand washing and perform the hand washing immediately after removing the gloves. And gloves is not required in the routine care practices, like when you are going for giving any administrations or doing a vital signs. All details I will explain in the later slide. So in that case, when you're providing the routine care activities, in that case the gloves are not required. So to in the routine care activities. Then wear gloves when touching the blood and body fluids, etc. It's like when you are handling something which is body fluids, secretions, excretions, the mucous membrane. So in that time you need to wear the gloves to protect from the infectious agents or coming in the contact with the body fluids. So now different types of gloves. So there's a different types of gloves are there: sterile gloves, clean and non-sterile gloves, heavy duty or utility gloves. So sterile gloves, it is used or it is meant only for the single use, and it is used in an aseptic procedure. It should not be reused after washing. So that is meant only for the single use. Clean and non-sterile gloves, which is used for examinations and wherever non-surgical procedures are being performed, and whenever you are handling any visibly soil with the blood, body fluid, secretion, excretions, etc. So in that case you need to wear the non-sterile gloves, and there is no need to wear the sterile gloves when you are doing all such procedures. And whenever healthcare workers is having open skin lesion in the hand, so they should also wear if they are having any skin lesion in the hand, so that the infection cannot or should not transmit to the patient side. Then the non-intact skins. So in these conditions, if you're providing any of the care to the patient, so always use the non-sterile gloves. And heavy duty or the utility gloves, which is used when the healthcare workers or the group D workers are doing cleaning of the floors in the wall, or decontamination of the large equipments, or cleaning of the furniture. So in this case, the heavy duty gloves or utility gloves should be used or should be worn. And these gloves can be reused with soap and water, and it can be used after drying properly. It can be used after the cleaning. So this is the gloves pyramid, and according to this pyramid, the when we have to wear the gloves, it has been categorized as sterile gloves indicated, examination gloves indicated in the clinical situations, and the gloves not indicated except for the contact precautions. So we will see one by one this pyramid, what this pyramid indicates or what this pyramid says from top to bottom, from wearing from the sterile gloves to not wearing of the gloves. So the sterile gloves indications. So when we need to wear the sterile gloves, whenever we are doing any surgical procedures where the body is being opened or it is not intact. So in that conditions, the sterile gloves need to be wear. Performing vaginal delivery, any invasive radiological procedures are being performed into the patients, which requires for insertions of anything to the patient body and access to the bloodstreams. So in that case, the sterile gloves need to be wear. Invasive procedures like doing inserting a center line or caring for the center line, preparing TPN, that is total parental nutrition, or preparing the chemotherapeutic agents. These are the two fluids or liquids or the medications which being inserted into the body. So when anything is being inserted in the body, it should be all aseptic precaution need to be maintained. So these are the conditions or the indications where the sterile gloves need to be worn. Now the examination gloves, which is indicated into the clinical situations. Examination gloves, it means that these are the non-sterile gloves. Just the non-sterile, it means that it's not sterile gloves, only that it is a gloves which is used for this purposes, like when potential for touching the blood, body fluids, secretion, excretions, and the items which is visibly soiled by the body fluids. So there's the two cases, like if you are directly contact with the patient, that is direct patient care, and indirect patient care. So direct patient care is when contact with the blood, contact with the mucous membrane, with the non-intact skin, potential presence for highly infectious and dangerous organisms, epidemic or in emergency situations, IV insertions and removal, doing venipuncture or withdrawing of a blood or drawing of a blood, discontinuation of the venous line, pelvic and vaginal examination, suctioning non-closed system of endotracheal tubes. So these are the conditions where you are coming directly to the patient, direct contact with the patient. But in these situations, it is not required to wear the sterile gloves. Indirect patients exposures like your when emptying the MSS basin, handling of cleaning of instruments, handling of waste, and cleaning up spills of the body fluids. So these are the events when indirect patient exposures where there is no need of wearing a sterile gloves, only non-sterile or examination gloves are indicated. So gloves which is not indicated except for the contact precautions. So no potential of exposure to the body or body fluids or contaminated environments. So here also there is a direct patient exposure or indirect patient exposure. So direct patient exposure, it means that taking of vital signs, performing subcutaneous or intramuscular injections when you are providing care to the patients, like bathing and dressing the patients, transportation of the patient, caring of eyes, unless and until there is any secretions. And any vascular line manipulation in absence of blood leakage. These are all the incidents or events where you no need to wear the gloves when you are coming to the direct patient exposure. Indirect patient exposures like using the telephonic writing in the patient chart, giving oral medication, distributing or collecting the patient diary trace, and removing and replacing linen for patient bed, placing non-invasive ventilation equipments, oxygen cannula, and moving patient furniture. So these are all the events where you no need to wear the gloves unless and until there is any potential for exposure. But in these cases, there is a no potential for exposure for any blood or body fluids or contaminated environment. So you can work with the bare hand, means without any gloves. So all this guidelines, which is it is taken from the recent update from the module, that is National Guidelines for Infection Prevention and Control in Healthcare Facilities, that is Ministry of Health and Family Welfare Department, and this module was released in January 2020. Thank you.